Prolozone. Hello, everybody. This is Dr. John Pitts from the Centennial Schultz Clinic. Today, I'd like to talk to you about Prolozone. So, what is Prolozone? Prolo, the first word, means proliferative. It means stimulates some proliferation and repair of tissue. And the last part is ozone, which is the gas that's found in our atmosphere that protects us from some of the harmful UV rays from the sun, used for proliferation in musculoskeletal medicine. So what is Prolozone typically used for? So Prolozone is an injection typically used inside of a joint such as a knee, intradiscal, or into muscles to try to stimulate repair, improve pain and function in those areas. Many times it's combined with some vitamins, and it's maybe comparable to a prolotherapy injection, which is typically just a sugar water injection. And so, is this therapy safe? Based on the evidence, it's maybe mostly safe, but a lot of the machines used to make ozone aren't necessarily sterile, even though ozone does have a strong antimicrobial effect. I have seen a case of someone having a really bad infection being injected into a disc from this therapy. And so what about the evidence that Prolozone can help musculoskeletal problems? So there's just a couple randomized controlled trials I was able to find on Prolozone for things such as knee arthritis. And they compared it to a placebo injection, which is maybe just saline, or compared it to a typical injection of prolotherapy or hyaluronic acid. And basically it was better than the placebo injection, but it was no better than hyaluronic acid or a prolotherapy injection. And most of these studies were small number of patients and only followed the patients up for 1 or 2 months. And I think the consensus I saw in the literature is that it maybe has some short-term benefit, but it's not as much evidence for long-term benefit. The same with maybe some back problems, and maybe has some short-term benefit, but it doesn't show any evidence for long-term benefits as of yet. If you compare Prolozone to something like PRP, Dr. Centennial just blogged on randomized controlled trials related to PRP. There were 29 studies that are out at this time. They compared prolotherapy to things such as, they compared PRP to things such as prolotherapy, hyaluronic acid, steroid injections, medications, therapy. And in 28 of those 29 studies, PRP was significantly better than the placebo or the alternative injection of medicine or therapy. The results were with larger number of patients for the most part, and for longer follow-up, up to a couple years or so. So in conclusion, based on the evidence, based on my experience with patients, Prolozone could potentially be a short-term benefit therapy that's maybe not much better than something simple like prolotherapy or hyaluronic acid, and certainly does not have as much evidence or safety profile or long-term follow-up as PRP, which has excellent evidence now that it helps with things such as knee arthritis and many other musculoskeletal problems.